Hi, hello, welcome to today's episode. My name is Dr. Nitin, and today we are going to talk about how digital healthcare is going to help the doctors and the healthcare industry. So, if you're new to this channel, please subscribe to this channel where I share various tips, tutorial ideas, strategies related to growing your clinical practice digitally. And if you feel that you want to grow your clinical practice, stay tuned with today's episode because today's episode is going to be very helpful, interesting, and very useful information we are going to get because we have a very special international guest who is going to guide you us about the practice of digital healthcare. So, without further delay, I welcome you, Ronnie, for this special episode uh, because Ronnie is a engineer turned a business marketing expert, and he has having more than 30 years, 36 years of experience, where he has worked with various biggest one of the few of the biggest companies, where he was able to build millions of dollars of business, and not only that, he was able to take few organizations to the he was able to then make public listed companies. So with his extensive network, expertise, and experience, he helps healthcare businesses to grow them. And he is particularly interested and expertise with the digital healthcare systems, remote patient management, and various other patient management healthcare systems. And he is a digital healthcare expert with he has done various leadership roles in business development and marketing across multiple organizations. And he has played very key roles in the product management and clinical development, right from marketing, sales, and marketing positioning. So, with that brief introduction, I welcome you, Ranu, for your time and welcome to this episode.
Thank you for having me. It's a pleasure.
Yeah. So without further delay, let's get started with today's discussion. Rani, can you tell us about what do you think? What is the digital healthcare according to you?
Okay, so digital healthcare is an interesting piece of technology that will enable both personalized and proactive care. We're moving from reactive healthcare in the world to proactive healthcare, and digital healthcare is the enabler.
Okay, fine. So what do you think? What are the problems that can be solved with digital healthcare across the patient care in terms of, let's say, access or healthcare delivery or cost, or maybe another some other factors? What do you think? How does like what problems it can solve?
Okay, so it's very interesting that the solutions are varied, and again, they can be from drug as well as proactive care. Solutions can be the issue is that there's a lot, you're gathering a lot of data in digital healthcare, and that enables you to get a better picture for your solution. So the AI, the machine learning part of digital healthcare is what's going to change the paradigm of healthcare today in the world. Digital healthcare also enables proper healthcare for rural populations, populations that in the past have not gotten proper treatments. So there are many varied solutions out there, and more are in the works. There are several thousand startups, if not more, in the world working on digital healthcare solutions, and it's mind-boggling. I just got back from the biggest healthcare exhibition in the world, and every year you see lots of great innovation, and innovation is what's going to drive digital healthcare.
So innovation is the very critical factor in any aspects of healthcare, whether it's on the clinical aspect or whether it's on the technology development aspect. So that's a very interesting point. And why do you think, like the doctors, why do you think for its doctor, this adopting this digital healthcare is very critical? Let's say in terms of maybe patient management, or maybe in terms of their clinical practice growth also, or the business development in terms of healthcare businesses. Why it is very critical to adopt this kind of digital healthcare technologies?
Okay, so digital healthcare technologies are enabling physicians or clinicians as a whole uh, to ease the workload. In most of the world today, we have a massive nurse crisis. We also have a crisis of physicians as well in some countries. And digital healthcare can ease the burden. Digital healthcare will not take over the physician's job. It's just a tool to enable to treat more patients with less time. Again, being able to look at patients, give them personalized and proactive care is going to be the biggest enabler for the physicians in order to alleviate lots of different sicknesses or issues that come up as complications. So I see this as a great tool. I don't see this as something that's going to eliminate the work of the physician. And again, we've seen this time and again throughout history. Technology has enabled us to do more. Again, if you're looking at the involvement of fax, computers, emails, it enabled us to do much more in less time. So this is where digital healthcare is going.
Yeah. So definitely, like countries, the developing nations like India and some of the Asian countries, which are still in developing phase, they have really huge uh, limitations of the healthcare personnels and expert professionals, doctor, nurses, and other healthcare resources. So I think that's a valid point. This kind of digital healthcare technology can definitely increase that accessibility, and it can reduce the cost of medical treatments and reduce the overall burden also. So these are the fact. These facts are there, but what I have seen is that the digital healthcare technology has immensely grown in last 1 or 2 decades. But from the clinician or from the doctor's point of view, I really see there is some gap and some resistance from doctors in adopting this kind of digital technology. And I'm not just talking about like the developing nations, but even the developed nations in maybe some European countries or some American countries also. There also, I see this resistance coming from the doctors. So what do you think, like, why that kind of resistance is there?
Okay, we know this from other fields and other areas. The older population is more resistant. I see the younger physicians adopting this rapidly and excelling their practices. I see this everywhere in the world. So the adoption is going to come from the younger clinician population, and it's going to take some time. But also, there's another factor to this. The technology is evolving and maturing. Some of the early edition technologies were premature and really created more work than it saved. So lots of different physicians were quote unquote burned by trying a new technology that didn't really work. But as with every technology, it takes time to mature. It takes time to come. And I think we are now at the turning point as far as the global world technology, the turning point of the maturing technology is coming to phase now. You see more and more technologies, you see more and more organizations adopting this. Okay. You even see the big tech companies that are not in healthcare coming into healthcare because they see the big potential in digital healthcare. I'm talking about the Amazon, the Google, the Apple of the world are coming into healthcare very rapidly because they see this as an enabler. And what's interesting with digital healthcare is a lot of different people who have not been involved with healthcare at all are coming into this field. I'm talking from the technology side, from the developing side. People who were involved in computer technology have come into the digital healthcare space because they see the potential. So you're getting a lot of more a development power on the technology side from from the industries, from the different industries than you've had before on just regular medical technology development. So it's a very interesting time, I think, as far as the digital healthcare development. And I see this as a huge potential, especially with the vast amount of data that the digital healthcare technology is now enabling. And that's going to be the big differentiator.
So, as you mentioned, the generational gap was the one of the resisting factor, and which maybe in future will not be a resistance factor because newer generation is easily adopting the things. And also, you are mentioning that the technology, the use of the technology, the ease of access, the ease of use, the simplicity of the technology is something which will maybe drive the adoption of technology in the future. Yeah. So, so what do you think, Rani, like how this digital healthcare revolution is going to evolve in future, and particularly like the developing countries like India and some of the Asian African countries, how it is going to help, particularly the doctors, uh, in future by this digital healthcare technology revolution.
Okay, so let me take a case in point to give you as a good example, but this can be extrapolated into other technologies as well. A contactless remote patient monitoring is basically a patient monitoring, vital sign patient monitoring without wires, without having to do anything really, through clothes, through everything. So the patient doesn't have to do anything. Is special to be monitored. Okay. This is 24/7 monitoring, and it's accurate monitoring. Again, there are many different remote patient monitoring systems out there, but Natera is one that's developed its own high frequency radar technology to give the best accuracy out there and additional vital sign parameters. Now, why is this is so important? Because this is able to give a vital data for clinicians, um, to be able to, again, personalize the treatment. And it's also a tool that can give you data of deterioration and patient deterioration in advance. So you could do proactive care and not just reactive. So again, this I see as a tool to be able to really help advance proper healthcare in rural populations. Right now, this technology is used in hospitals, in departments where there's no monitoring, like general care floor. It's being used in nursing homes where there's no monitoring at all for elderly care. And it's being used or to be used in the home care for chronic patients. And again, it's 24/7 monitoring, so you're able to see historical data of the patient. You're able to see trends of the patient vital signs. So you're able to detect deterioration of the patient. You're also able, through this tool, to eliminate a lot of the different false alarms because you're actually looking at historical data. So again, this, and it's a small little sensor that could be either put above the bed, near a TV sofa if the patient is there most of the time, or in a clinic for monitoring several patients a day, um, whether, or in a clinic. So again, the fact that you're looking at them 24/7, you're gaining their data, you're able to average the data and eliminate the lots of different false alarms. So I see this as one of the many tools today available to personalize the care, to give them proactive care rather than reactive. You don't want to wait until a patient is in distress in order to take care of them. So again, this is one example. There are many more out there. And I think these are game changers, especially for rural population.
So I see there is definitely huge potential for this digital technology to improve the patient healthcare delivery system. It's not going to help the patients, but also to the doctors or caregivers to improve their efficiency and increase their business growth also on the as a the connected parameter to the patient care. So, but what I see is that though technology has come a long way in past few years, but still there is a long way to go for the doctors to adopt this kind of digital technology, and also at the same time the technology developers to develop a technologies which is easily accessible or easily usable with the simplified versions of the technology, which can be easily used by the end users. So with this, I thank Rani for your uh, valuable guidance and insights. Definitely, it will help our audience. And if you have any questions, you can ask your questions in the comment section. And we will be happy to answer you questions related to any digital healthcare technology or services, problems that you're facing or any solutions that you're seeking. So I hope to see your questions in the comment section. And if you felt this video was useful, please do like this video and share with your doctor friends or any healthcare business owners so that they get valuable insights from this video. And if you are not subscribed to this channel, please subscribe it to this channel again. And that's all for now. We will meet in another episode with another topic with another guest. Till then, bye bye from Dr. Nitin signing out. Thank you.